Not everyone needs to sign up for and start paying for Medicare Part B at age 65. I'm going to explain what creditable coverage is in this video. Hi, I'm Sylvia Gordon with the Medicare Family, themedicarefamily.com. And a lot of people, I would say the majority of the country, knows nothing about Medicare. Okay, that's fine. Don't feel bad about that. You're in the same boat as everybody else. But the one thing people do know is they have to sign up at 65 or they're going to get a penalty. And that's not true. More and more people, especially with COVID, more and more people aren't retiring at 65. They're going to continue to work indefinitely. A lot of them have to continue to work. They need the money. A lot of them want to continue to work because they like the money. And a lot of them maybe don't even have good money, but they like their job. You know, they want to keep going to work, have something to do. 65 is not old. So if you are continuing to work, and this is the key part, for a company with at least 20 full-time employees, it's just the federal law, don't ask me why, then you do not have to sign up for Medicare Part B. Now, if you work for a small company and they have 5 employees, 8 employees, 10, under 20 full-time employees, and you don't sign up for Medicare because you messed up this rule, then yes, then you will get a penalty, a late penalty. It's a lifetime penalty. It's 10% that you'll pay extra every month for every 12 months that you were supposed to sign up that you didn't. So what I'll typically get, I'll get somebody that's turning 65 and they're like stubborn, hard-headed. And most of my viewers are women, but ladies, stick with me here. It's your husband, okay? It's your husband. And he goes, I've already paid into the government my whole life. They've taxed my paycheck my whole life. I mean, this is just a direct quote from lots of my clients in the last 25 years. What I get from Medicare Part A is paid up. I don't have to pay for it. I'll take it. Medicare Part B, I don't need it. I'll just go with the free part I get from the government. I'm healthy. I hardly ever go to the doctor anyway. I'm good. I get those guys. Well, you know what happens with life, right? 3, 4, 5, however many years later, something big happens with your health. And then he gets a bill for $50, $60, $70, $100,000. Yes, that's happened to me many times. Those clients have had that high of a bill. Then they come in with their tail between their legs and like, can you help me? Of course, I can sign you up for Part B. You're eligible, but I can't sign you up necessarily today. There's only certain periods where you can sign up for it. And that law also changed. So starting in 2023, you'll be able to sign up. If you're a late person, you need to get back on that train. You'll be able to sign up in October or November or December, and it'll start the first of the next month. So if you come to me in January, you can see you got to wait all the way to the end of the year. Not only that, but how many years you didn't have Part B, so maybe it was 3 years that you didn't have it, that you were eligible, you got to pay a 10% penalty for those 3 years. You got to pay 30% more. So in dollars and cents, how much is that? Well, let's say you're paying $200 a month for Medicare Part B at that time. You'll pay 30% more every month. You're like, that's not too bad. Yeah, but Medicare Part B goes up every year. It went up 15.6% this year. So it's going to take a jump every year, and your penalty is going to go with it. It's a lifetime penalty. It will never go away. So my number one thing is I want you to know what the penalty is and not fear getting the penalty if you're working for a company with over 20 employees. Because I have a lot of people, they're not really sure. So they're like, I'm just going to sign up for Part B anyway. I'll just sign up just to be on the safe side. That way, I don't really understand how this penalty works, but that way I know I won't get a penalty. That's true. But I also hate that because I'll have somebody that comes in and they'll say, I'm getting ready to retire. And let's say they're 70. And I'll say, great, we need to sign up for Medicare Part B, blah, blah, blah. And they go, nope, already did that at 65. I said, well, you've been working for Nabisco with 20,000 employees. You didn't need to sign up for Part B. You didn't need to pay, let's say right now it's about $170 the average person pays. So $170 a month, so it's $2,000 a year for 5 years, at least 10 grand plus interest that you didn't need to pay. And they're like, oh, good. Can you help me get it back? No, that ship sailed. What I can do is help other people out there not sign up for it, not pay for it when you don't need it. Now, yeah, you can sign up for it because you want it. And if you were really sick and you had a lot of out-of-pocket costs, you could stack Medicare Part B up against your group health insurance. For most people, your group health insurance is adequate. You don't need to pay this extra Part B. Don't sign up for it. You don't need it if you're going to work for an employer with over 20 lives. And that goes for your spouse. So if I'm continue to work, I can keep my spouse on my plan too. There's no penalty for my spouse as long as this employer has over 20 lives. So if I'm self-employed, I got to sign up for Part B at 65. If I'm working for a small company under 20 lives, I need to sign up for Part B at 65. How about if I qualify for my healthcare through the VA? The VA is separate from Medicare. The two never meet. You can't use Medicare in the VA in general. You're not using the VA outside of, you can a little bit, but that's another video. So if you have VA coverage, you don't have to sign up for Medicare Part B. So a lot of people don't. I'd like you to do it if you can afford to, but that's another subject. So you have the VA coverage, you qualify for it, you're already in the system, you're going to the VA for all your health care, you're happy. And in a couple of years, you're like, I'm not as happy with the VA as my friends are that go to Medicare. I would like to sign up for Medicare Part B, get a $0 Medicare Advantage, and have some of these extra benefits. Transportation to and from the doctor and the pharmacy, meals if I have a surgery, that money that you can get on a flex card every month for the pharmacy or over-the-counter benefits. I'd like some better and more comprehensive dental, hearing. I mean, there's just a bunch of these extras in Medicare Advantage that I want. So sure, you can do that. But the VA was not creditable coverage. So if you were on the VA for 5 years and you decide now I want to get Medicare Part B, you're 5 years late for Medicare Part B, you're going to have that penalty. Now, it's not the same with Part D for drugs. As far as the VA goes, D is considered creditable coverage. Creditable coverage means as good or better than Medicare Part D. Therefore, the military's drug benefit is fantastic. It's better than Medicare Part D. So if later you decide, I want Medicare Part D, there is no penalty. So that's some good news that I'm bringing you. Employer coverage is considered creditable coverage. It's as good as or better than Medicare. So creditable coverage, I hate to use jargons and all the industry acronyms in my training because I hate them and I know you guys probably hate them, but I'm throwing that out there because that is kind of one that you have to know. So spread the news, tell your friends if you're going to continue to work past 65 with an employer that has creditable coverage, which means it's as good or better than Medicare. They have to give you a notice every year that says that. And in general, most large employers, it's going to be credible. If it's over 20 employees, that's all you care about. You don't have to get Medicare Part B. You don't have to pay for it until you want to come off of it. Now, that being said, just because you can stay on your plan at work doesn't mean you want to. You're like, what? Just because you can stay on your plan at work and you don't have to take Medicare Part B doesn't mean you might not want to take Medicare Part B. You might want to come off your group plan because your group plan might not be as affordable as Medicare Part B. And you won't know that unless you do a cost-benefit analysis. How much does it cost to stay in your group plan? What is your deductible? Is it a $5,000 deductible? A lot of plans are. You might want to come on Medicare, get a Medicare supplement, and have a $233 deductible. You might have better coverage at a better price on Medicare. So just because I spent the first whole part of this video saying, hey, you don't have to sign up for Part B, you might want to sign up for Part B and come off your group plan. I can't tell you that. You know how good your group plan is. You can dive into that and get the details. You can call us the Medicare Family, and then we can do a comparison for you and give you some advice. Our advice is free. We're open 9 to 5 Eastern, 1-800-970-1964. You never call to talk to us. You never call to work with us. So we're paid by the insurance company as independent contractors if you want to buy a plan. You don't save any money by not working with an agent. So if you have questions, we're here to help you. Just give us a call. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question always feel free to call us or email us at the Medicare Family.